Are there any questions?
I got some. Say it's easy, what about the security of your personal data? I mean, I guess they were testifying that the hacker could break in here readily and get your data off that website.
Well, it is related to Social Security, IRS, and everything else. I mean, typically, yes, nothing is, I mean, you're saying then a hacker could have the
They're
CIA.
more vulnerable than most government websites. It's easier to get into because of the bugs.
Well, those bugs should be, they said that everything should be fine by the 30th. I can't attest to how perfect it is, but I can attest that it's the government and they're going to have this pretty much on lockdown, especially with the information that is floating around there. I don't know
I
what
just
part
want
of
to
it.
secure because I don't want to put data out there to get hacked.
Yeah, no, I get that, obviously, your data is very important and your information, and it's nothing, just something to laugh off, but all government websites, or any website you give your information to, has security on it. And the government is making these things tie together. I mean, even though your information bounces around to the different sites, the IRS has their information. I mean, hackers that do everything every day. You know, we can only do as much as we can. And these government websites are usually top of the line. We trust Amazon.com with our credit cards. I did.
They're all efficient.
Can you explain a little bit more about the 8% of the income?
Yes, if the lowest plan available to you is 8% or more of your income, that's deemed unaffordable. So then you're exempt, but you're probably going to fall into Medicare at that point.
Okay.
Or Medicaid, I'm sorry.
So if you're paying more than 8% of your income to your employer
For their plan,
for their plan?
then you can negate, you can opt out of their plan and then look individually.
Okay, that's
Definitely.
like individually.
Yes.
The question is, if, say, your income for 2013 is below the poverty and you would qualify for Medicaid, and that would change next year when a person is entitled to early retirement, so you have more of an income next year, what do you do at that point when he's going to go over the Medicaid allowed amount?
Well, that's one of those life-changing events, which obviously your income changes. Then that's a special enrollment period you could enter, and then you would just adjust your profile to indicate your new income, and then things would happen accordingly.
So you would do that, like, say, in June, if that was something?
Yeah, if something like that happened, if I lost my job in August, I go in, I change it, update my status, my actual income is going to be, and then that'll tweak my premium tax credit either way. And yes, but that life-changing events like that, of course, are open for enrollment.
Okay, so that can be adjusted then?
It can always be adjusted, yes. Yeah.
I'm sorry, which one?
Go ahead, you can.
Okay. Two questions. One, you have to put your personal information in before you can shop, correct?
I mean, before you look at the marketplace, yeah, because it won't know your tax credit.
Right, but I mean, you don't even know what plans are there until you put all your information in.
No,
You
you
can't
can look
even
at-
get to that point, right?
No, you can't. You just won't be able to see the plans. You can look up plans in your region, which will give you a general idea.
How do you do that?
Healthcare.gov. Look, I can show you that later. Well, I can definitely show you, give you the link if you want. But you can go on there, you can look at plans, those were but they're not going to have the tax credits or things like that. And they're not going to be full of detail, I'll say that. If there's a certain company you like, then you can definitely get a hold of them, and they will send you some more detail. But the ones on healthcare.gov, that's going to be more of a general overview of ones in your area. And it's going to be limited, I guess I should say. It's not going to have all the detail on it.
Right. My concern with that is that those credits really only depend on certain information, which does not include your social security number or really personal information, but yet you have to still provide all that just to get to that point.
Well, the part about the whole social security number, that's just to verify you are you. There's a list of questions also that make sure that it's not just, that guy over there using your social security number to sign up for health care and have you pay for it. So,
Right, but I can see your social security number when you want to enroll. That has nothing to do with whether, you know, that, whether you want to look at the plans with your subsidies, or if you're entitled to subsidies. All that's based on is your income, do you smoke, where do you live? And they would be able to determine your subsidies. They don't need to know any of the personal information. I just want to make sure that.
what personal information do you think, I guess
The only thing they're really asking you personally, other than your name, rank, and serial number, am I right? They're not asking you they're not asking you for any credit card numbers.
no.
They're not asking you for anything other than your social security number to be acknowledged at that point. Is that what you're saying?
Yeah, I
Alright.
haven't run into, like,
Okay.
if you file, no, I mean, if you file your taxes jointly, they're gonna ask about your spouse or whoever you're filing jointly with, but
I understand.
Another part of the reason they ask for your social security number is this program links up directly with the IRS to show your tax information for the prior year to help you move through the program. So not only does it determine that it's you, it helps you determine how things go throughout the rest of the program, and that's why it's so essential. Does that make sense?
with the sliding scale,
It doesn't add up for me because they ask you how much, I don't want to belabor this, I know.
oh, no, I just want to answer your question.
A lot of questions. But they ask you for your income.
Yes.
No, really, you should be able to plug in any income you want.
No, because it's how you,
Exactly.
it's how you file your taxes.
Yes.
So, let's say you earn a $400 a month premium tax credit, okay? But you just lied to me about your income.
Right.
I'm the government and I'm subsidizing that income. But I have your number, so when you file your taxes, I go, you lied to me. That's gonna have to be reconciled.
I understand, but I'm not buying anything yet. I mean, once I buy, yeah, I mean, then you got a social security number, you got all that other stuff. I understand. Just like if I buy something online, I gotta give them my credit card number.
Okay?
That's all I'm saying, is that you've got to go through this whole process just to see what's available. That's, you know,
Well, like I said, you
if I
can get a
really aren't gonna
general.
buy anything, I want to, it's just like what this gentleman said, I don't want to give my social security number, all I want to do is shop.
But maybe you're not qualified to be in the marketplace. It's gonna help direct you to where you are. You can also, like I said, you can see a general overview of plans. Now, if you look on the website, you go, oh, you know, Anthem seems all right, or MedMutual or Coventry, and you just go, okay, I'll get a hold of them. They can send you the plans in the area. I mean, that information, I mean, the Social Security is just to determine who you are. Your income is just to determine if you do get, subsidies, or, and actually lets you know if marketplace is right for you. You might make too much, who knows? I don't know. But it's just so the government can determine, and
I
then they
have one
can show
other real
you.
quick question without beating this to death.
Yeah.
On the one point that you said that this plan in this part of the country might be 70-30, but then in this part of the country, that same plan might be 87%.
I've seen it change a little, yeah.
Does that variance change year by year, depending on how many people sign up for the different plans year by year?
Kind of, that one plan that ended up changing, that was because it was considered the benchmark. And more people, so the more people that sign up for any plan or any level, the larger the pool you're pulling from, the more risk it distributes, so it's less of a risk for the insurance companies.
Right.
So then thus they do cost sharing to make it more affordable, because they want everybody to be around this benchmark area. Now, some plans are going to be lower than that, but with the benchmark, it's the idea. Also, based on the socioeconomics of that area, it's going to be sliding scale.
Right. But my concern is that if it does vary,
Yeah.
okay, if it can vary, and I understand what you're talking about, the risk factors only.
Yeah.
If normally it's 70%, but at this particular year it's 87%. So here I am, I buy in,
Yeah.
and it's 87%.
Yeah.
Then the next year, that changed. That 87% now became 78%. I'm on the hook for a whole lot more than what I expected. Is that something that could happen?
That's going to be determined with your insurance company. I think if they lock you in at that area, it's been pretty substantiated that that cost, they look at the area cost for a period of 5 years. So they look at the income of that area for 5 years. Whether that will change after 5 years, based on the incoming data that they have collected, based on just the income for that area, that could happen. That could be something that's negotiated with your insurance company. But that's also something that happens with insurance companies all the time. I guess one of the points I want to make about this is just regulation. It's not, you're not getting health care through the government. It's not a public option or anything like that. So insurance companies change their numbers all the time, and you might get a letter one day that says, you know what, you got to pay a little bit more now. But maybe when you enter into the information again, because if the economics of that whole area have changed, your economics have changed. So then again, you change your profile, might get a bigger thing to actually subsidize that cost of the change.
Well, are you allowed like once a year to go in like and
You can look at your thing every year, yeah.
once a year, like once a year they're gonna let you go in and say, okay, we want to stay with this one or we're gonna change, just like they do with the Part Ds on the.
Yeah, just like any other insurance plan. Open enrollment opens October of next year. Unless you have one of those special life-changing events, which I mentioned, you can then look. Most people, there are a small percentage of this country that does change every year. They always look for the best deal. Most people just stay the same, but that's something you negotiate. You're probably get a letter from your insurance company saying, hey, if you want to, it'll just kick in again. But you have the choice. That's what's nice. You can see what changes there are and maybe the better deal that is out there. And I'm sorry, you had a question.
If you file jointly, do both people have to get it?
No.
And-
No, I just dealt with a couple whose husband was on Medicare, but she wasn't. Well, because they do file jointly, I do have to know his income information, because that's what's going to show up on their taxes later, and that still will determine that. So maybe before, if she would have filed alone, she wouldn't probably got Medicaid, but because they're combined income, it might get somewhere on the marketplace. But yeah, just because one's not using it, that's fine. It's just all how you determine, or how you file your taxes. If 3 different families, or you have 3 different people sharing the same house, that's not considered a household. It's all about how you file your taxes. That's what's considered a household. Yes.
Is there a 50% surcharge for smokers?
I do not know what the charge is for smoking. It's going to determine probably on your company or whoever you go with. I can't say, I mean, that's factored into your premium, but I don't know specifically what that number is.
Or it is higher, it could be higher?
You do pay more. You do pay more.
Based on individual plan, they can choose. So when you go through details of what that impact is, it'll show you on the
And yes, sorry.
My husband's thinking of retiring next June.
Congratulations.
When should we start looking on this website? We will need it. Is there, before it used to be like no one would give you an insurance quote. It had to be within 30 days of when you wanted to.
The life-changing event, that's what that would be considered. You have a 60-day period before you know the event's coming and a 60-day period after. So it's a pretty big window. I mean, that's especially because death in the families and other things can occur that you don't want to think the first thing, well, I have to choose my health insurance. So it's a pretty nice window you have going. Yes?
Okay, what if you have a college student and it's too expensive to actually enroll him on your insurance through work?
Okay.
Would then he qualify to enroll in this, or?
I mean, sometimes the schools do have their own health plan,
Uh-huh.
which mine, when I went to college, was actually pretty decent. But they file separately. And, I mean, even if they don't file separately, they can look in the marketplace.
But what, and I guess at that point too, then you could look at your costs, because if I added his costs into my plan, it could possibly then definitely go over that, where I'm paying more than 8%. So then maybe it would be, I would be eligible to look on marketplace for all of us.
Yes. Yes. How you file your taxes, if that puts you over at 8%, then you can look individually.
Because I still claim him on my taxes.
Of course, he's a dependent. I completely understand that.
But, right now he doesn't have insurance. So that's something that needs to be done.
Or, you know what, cut him loose, get yourself a tax break, and have him do Medicaid. Just kidding.
I don't want to do that. So I was just
Tell him to get a job. No, I would never say
and
that.
he is working part-time, but it's not enough.
Oh, of course, no, I did the college thing, trust me, and I get that. Yeah, I would just, if that's gonna put you over your 8% for your employers, but also check, because of the new plans that are coming in, your employer might have something else
It might.
that they haven't kicked in yet, that might make it more affordable, because like I said, there are tax incentives and other things. But yeah, definitely look at that, but if that puts you over the 8% and you're deemed unaffordable to get that health coverage, you can look individually, definitely on the marketplace.
Okay.
I'd always suggest it, just to do the best deal.
And then I also have another question, because I do work with the, I do 211 information referral, so we're getting quite a few questions on how to navigate the site and everything.
Mhm.
We have a lot of single adults, obviously they're not covered now, with very low income.
Mhm.
So should we go through this process with them, and then it would actually navigate us to where they could go? What-
Yeah,
what
so
they'll actually qualify for?
that's a good question. They mentioned then December 9th for the Medicaid, correct? And what that is happening is there's this weird limbo going on. And yes, it doesn't technically kick in until January 1st, but I would do the profile because worst case, it'll kick his application into this weird kind of limbo state until it's able to be pulled into their data bank and whatnot.
Because we advocate a lot and help people, so
Mhm.
I know we're getting several questions and people that needing assistance, so.
Yeah, I would suggest it just because, again, it'll put it in this weird limbo queue.
Okay.
Because if he goes directly, they're just gonna, no, you're done. You know, they're gonna boot him immediately until December 9th, technically January 1st, depending on when they get to him. But having his record or account in the queue makes it more available and quicker. Like, it's basically if you make an appointment anywhere.
Okay.
You know, if he does it after January 1st, then he's a walk-in, and it's gonna determine his place in line, I guess I should say.
Okay, so it is a good idea for us to
Definitely.
advocate and get them in before,
Yeah, I would say so,
okay.
yes.
I wanted to give kudos to whoever has the benefit.ohio.gov. It's in English, Spanish, and of course, my native tongue, Somali. Somali?
It's a very large population. of
Seriously?
Columbus, yeah.
We have a
I-
very large, small.
I couldn't believe that. It says English, Spanish, you understand that.
Yeah.
Somali?
Yeah.
Yeah, Columbus is actually one of the most diverse cities.
It's interesting, yeah.
Yeah, we have a
Would have never known that.
very large Muslim population, Somali population, gay population. It's just diverse.
Columbus is fun now.
Yeah, I mean, it was named one of
Yeah.
the like, top 10 smartest cities in the world or something like that. So, I mean, it's an amazing place. And by the way, the food, go. I mean, you can get anything. It's amazing. Japanese, Samoan, Ethiopian. There's some other, it's a small place. Yeah. Yeah, you get everything. It's amazing city. Any other questions of the cuisine or, yeah, I'm gonna hit everything you.
It's based on your taxes for last year.
No, obviously, you don't know exactly what you're gonna make this upcoming year. So, you know, just using your taxes for last year, if your income is usually the same, then, you know, use that as your basis for determining or guessing what your taxes are gonna be for this year.
Well, basically what we're on, we're on Social Security,
Mhm.
which was set, but I have a retirement book.
Yes.
I take money out of that. Or each month I get one lump sum.
Yeah.
At the beginning of the year.
Yeah, well, your retirement would count toward,
But that's still, it goes towards it, but I'm still under the whatever.
yeah, it's accounted for, but again, let's say you misjudge. You can always go back in and change your profile and have that adjusted. You know, using your taxes for last year is just a good jumping off point. I mean, but that is it's going to ask you, is this a consistent, when you put your income in, is that consistent? If not, they understand that what they're going to quote you or that your income later might change, because if it's not regular, if you do a lot of part-time work, I mean, that's something that can play and come into factor.
And it's only taxable income, what about,
The modified adjusted, the MAGI,
well, what about people that have child support or other income coming?
those things are considered in it. There were questions geared towards child support, though I have not run into anybody yet, so I actually don't know what that screen looks like,
Okay.
but there is a question about alimony.
They get social security.
Well, yeah, Social Security, but also student loans. So student loans are on there. And yes,
Does this impact a person receiving only Social Security disability?
only, I mean.
Only source of income is Social Security disability.
I mean, no, we just record it, and if, that's considered their income, correct? That's their only income?
That's their only income.
Okay. They could still qualify, I don't know how much they're getting paid, but they could still qualify, but if they don't, and they're not old enough for Medicare, it would fall under Medicaid?
Social Security disability usually results in Medicare.
Okay?
So you wouldn't go into it.
If that's more of a Medicare question, then I'm just going based off what I do. I don't have any dealings with Medicare. I just know the age for it, and I don't touch it. So
If you're on Social Security disability, once you're on it for 2 years, you go to Medicare. And then once you're on Medicare, you can be on the Medicaid expansion for the 2 years that you're waiting for Medicare. And then
Okay.
once you get Medicare, then it wouldn't be this affordable.
Gotcha. I just learned something. I didn't know that. And I think that probably when you were on Social Security disability, they would probably let you know about that then, if you are on Medicare. I would assume. But now I know that, so if anybody does ask me, I will tell them. Anything? Okay. Well, thank you for listening. I can help anybody in the back with more questions or more focused help, and all I'm not saying.
Now we're going to have Gail Justice from the Country Neighbor come and talk about prescription assistance. Prescription assistance program is funded through the senior levy.
I'm going to be speaking for a few minutes on the prescription assistance program for seniors. And as it has already been stated, it is provided through the Asheville County Senior Services Levy. It's been in existence and helping seniors with prescriptions for over a decade now. And before it came into existence, a lot of the funding for programs came from federal and state funding, but as the years went by, it became less and less. So then people that were providing these services got together and decided that they needed to do something else to make sure they could still provide those services. And that's how, with a lot of work and discussion and things, the senior levy was put on the ballot. And as already been mentioned, it was on the ballot the first time in 2000. And after being a 5-year levy, it's been renewed in 2005 and 2010. And the services actually began in 2001, after the levy was passed and the funds started coming in. And it's provided services like have already been mentioned in the brochure: home delivered meals, chore and homemaking services, the prescription assistance, supportive services, and transportation, just some of the services that are provided through this levy. Currently, there are 4 different agencies. Okay, those are the information I gave you. There are currently 4 agencies throughout the county that provide prescription assistance for seniors program. One is the Asheville County Council on Aging here in Ashtabula. Also at the Asheville County Council on Aging Geneva Senior Center, Conneaut Human Resource Center in Conneaut, and then Country Neighbor down in Orwell. And we have people that can come into the office, or we can go to their homes, or there are other places like I go to the Andover Library once a month, and I've also met with some people at the Senior Center in Jefferson. So there are different ways where you can come in and get the assistance. In 2012 alone, these 4 agencies saved well over $300,000 in prescription savings for senior citizens. And since Medicare Part D came into existence, not only can we go and help the people go to the prescription assistance programs of the different pharmaceutical companies, but now we go to Medicare.gov, we can actually plug in their medications and find what plans would be the least costly for them with the medications that they have. Each company has their own way that they categorize the different medications. So we look at the ones that would be best for them and the least costly. And if anybody can do that, if you have a computer and you know a little bit about computer, you can just go to Medicare.gov and you can go through that process yourself. But for those who don't have access to the computer or really feel like they don't know anything about a computer, we're there to help them go through that process to help find the best plan for them. And this help then that the people have received over these years can mean the difference between buying medications or buying food, or paying your rent, or paying other bills. So it's been very important. For others, it might mean taking their prescriptions properly the way they're directed to do it, rather than cutting it in half, cutting pills in half, or skipping doses so that you can make the prescription go longer. This can be very detrimental if you're not taking your medications as they're intended to be. Some can create more problems by not taking it as it's directed. So this is very important, and we appreciate all those who have voted for the levy so that it can be in existence, and it'll be coming up again in 2015 for renewal. It provides a bunch of services that we wouldn't be able to provide without it because of all the federal and state cuts that we've gone through over the years. Does anybody have any questions about the prescription assistance program or Medicare Part D?
You applied for this?
Yeah, you can, we look at the plans, and if you want to enroll right there, there's a way to enroll right there online, or calling the company right then and there if you decide that you want to go with that one company that you see. It's just like, it's a lot like it seems like it's a lot like the regular health insurance, the marketplace thing.
So I must have missed something. Because I didn't get where you go online to here.
For the Medicare, we go to medicare.gov, and it has a place where it says find plans, and then you can actually click on there. You click in your zip code, because different plans are offered in different areas. There's only certain plans in Ashtabula County, only certain plans in Trumbull, only certain plans in Geauga. So they ask you for your zip code so that they know what plans to look for in the area that you're in. And then we plug in your medications, your prescriptions, and it asks for, how much the dosage, how many you take in a month, whether you get it at a pharmacy or through mail order, because mail order most of the time is cheaper. We save quite a bit by doing mail order. And once we go through and add all the medications, then it'll come up with the plans in the area, and it usually goes from the least expensive to the most expensive. And you can compare 3 at a time, so we usually print those up so that people can look at them, and then they can decide then if they want to go on enroll right now, or if they want to take it back and look at it. The thing about it now is that the open enrollment ends December 7th, so we're coming up on the deadline.
So if someone has some major questions, they can just come to you of the senior center and someone will help?
Yeah, it might be good to call, make sure they're there that day, but yeah, any of these agencies that we showed you, Conneaut Community Resource Center, the Geneva Senior Center, Ashtabula Senior Center, or Country Neighbor in Orwell in South County, any of those agencies are very happy to be able to help people go through this.
In Geneva, they only have 3 days at somebody's there.
They're only open for 3 days, yeah, because I think they have a part-time employee there.
So how old a senior do you have to be to qualify? 65?
Past the prescription assistance program is anybody that's 60 and over and a resident of Ashtabula County.
60, yes.
Yes.
60?
60. Mm-hmm.
So how do you do it if you're not on Medicare?
We would go through the prescription assistance programs through the companies if you don't have coverage, or if you have less coverage, if you're underinsured. We can go to the companies. Each company usually has a prescription assistance program through the company where they provide low income and underinsured or non-insured patients their prescriptions either for free or for a very nominal fee. And each one has their own income guidelines and their own other rules as to how you qualify. But for people that are between that age 60 and the Medicare age, if they don't have prescription coverage or they have under coverage, we can try to get them their prescriptions through the pharmaceutical companies. And that's how the prescription assistance program was when it first started out, because Medicare Part D was not in existence at that time. So everybody was doing it that way. Try to get their drugs cheaper so they could still take them. Any other questions? Okay, Thank you for your attention.
Thank you.